Family education on dementia. How does dementia impact those affected with it and their families? The emotional, physical, and overall well-being and outlook of the patient can be impacted by dementia. Because it is a progressive disease with no cure, this can take a toll on them emotionally. Therefore, depression and other mental illnesses are common for those suffering, as well as their family members and caregivers. The emotional impact of losing someone you love to a progressive disease can take a toll on you. Just because like I said, there is no cure for dementia and it is progressive. So with time, it does worsen. This can also bring about frustration with memory loss and fluctuating orientation. It's really common for people to have good and bad days with dementia. So the fluctuating orientation and overall cognitive function, because it fluctuates, it can bring a lot of frustration and confusion to the family. And our job, as far as counseling patients and families, we have to express empathy, which is just allowing the patient and their family to work through the grief process and understanding and providing them with understanding of how this impacts the acceptance of the diagnosis and the prognosis. This also brings about the need to counsel on the prognosis. The family is going to come to an understanding that dementia is a condition that worsens over time and its effects become more pronounced. And because there is no cure, this is something that we have to prepare them, both the family and the patients, to be aware of. And then overall education, preparing the family for what that looks like and how treatment will adapt as the disease progresses. This goes back to that the global deterioration scale, just really preparing the family for how the disease progresses, what it looks like, and what to expect can help tremendously if they know what to expect and they know what they're preparing for.